Hi guys, this is Tanya from Star for Brooklyn. I hope you guys are doing well. This is a crazy time that we're living in right this very second. And I know that people are scared and they need information. They need to try to make sense of all of these changes. So in the next couple of weeks, I'm going to be trying to post a lot of videos to help provide you with information about what's going on and how to take care of each other and to stay healthy. Okay, so let me first move my picture there up a little bit. This is a little presentation to give you like kind of a 101 on what is the coronavirus and what you need to know about it, okay? So the coronavirus basically is like this class or this family of different types of viruses. And the thing that they all have in common is they create respiratory infections, or excuse me, they result in a respiratory disease. Um, so the big name, fancy name is called coronavirus. You may have heard of some like the SARS virus years ago. That was a type of this coronavirus. Some are really mild and some are very serious. Fortunately, this COVID-19 is serious, and we really, really need people to take this seriously. So it's called COVID-19, which I know is like, what's that about? So in science, they like kind of often like attach weird names and labels to stuff. And so COVID is like sort of a short nickname for coronavirus. And 19 represents the year that it was discovered, which was at the end of 2019 in China. So what we do know, guys, is it is highly contagious and that it is spreading easily through our community. Um, there's been a lot of people talking about community spread where it's spreading out and we don't know about it. And the truth is, I think that we have to assume in living in our high density area that we do indeed have community spread here in Brooklyn. So, I know also a lot of people are like, like, how is this different than the flu and blah. So it's like, it's a little bit confusing because some of the symptoms are similar. So on this particular slide, I just like kind of put up some similarities. Like, yeah, they both lead to fever and cough, or they can produce those as symptoms. Unfortunately, when they get really serious, they both can result in death due to respiratory failure. And that's when, your respiratory system is so inflamed that it's difficult for you to breathe and everything kind of shuts down. It's very hard, or horrible, I should say. It's spread in the same way through these things called respiratory droplets. So like when we cough and sneeze, we're sending out these little things floating in the air. You can't see it, but they're there. And we know that both of them can be prevented with good hygiene, washing your hands, covering your cough, limiting your access to people who are sick. And we do also know that like they can both spread before people know that they're sick. So this is something that is of concern for us. How they are different is that the coronavirus is a new disease. We don't know anything about this, which means that to a certain extent, our experience and our immunity to this virus is limited. Whereas the flu has been around for 500 years and we are familiar. It comes back every year. We're not sure if this is going to come back every year. We don't know. There are a lot of unknowns about this. We also don't have a vaccine for coronavirus yet. Hopefully we will very soon. But vaccines can take a long time, from 1 to 2 years to get a vaccine, a really good vaccine to get out to the people. The incubation period, and incubation is kind of like from the time you get it to the time symptoms develop, is also a little bit longer with the coronavirus. So it can be about 14 days as opposed to 5 to 7. And this is the most important thing. Influenza, flu kills hundreds of thousands of people every year. But the mortality rate with the coronavirus is much larger, which is the reason why we are taking this very seriously, because if we don't slow the spread of this disease, we're going to see a lot of deaths and lose a lot of members of our community. So what are the symptoms for COVID-19? You can, some of the mild symptoms, which are also like mapping on to other things, seasonal colds, etc., sore throat, a runny nose, sneezing, aches and pains, a headache. 2.5 weeks ago, I developed a little bit of cold. It was a sinus headache. Maybe I had COVID-19. I have no idea because I haven't tested. But, they were mild. And then all of a sudden, it turned into a respiratory infection. And that's when I decided to personally stay at home and work from home because now I'm at risk. And I'll tell you about that in a second. But the real severe respiratory symptoms are, if you have a fever over 100.4, the combination of a fever, cough, shortness of breath. If you've never had a respiratory problem, you'll know it's like, what's going on? I can't breathe. Shortness of breath. Often our fear and anxiety about not being able to breathe easily might make it even, might freak us out, and then it might make it worse in terms of our shortness of breath. And also pneumonia. If you've had pneumonia before, your pneumonia symptoms, you're vulnerable to getting pneumonia. These are really serious symptoms that you will then need to think about seeking emergency help, okay? And again, the exposure, it's been as short as 2 to 5 days. Most people sort of saying, it's the symptoms from the first time you're exposed to it to getting it is about 5 days. But some people are saying that symptoms can manifest in 14 days. This is just like a slide to sort of like show you kind of how some of the symptoms are like overlapping with like common things like allergies. This is allergy season. Itchy eyes, a stuffy nose, sneezing. My kids have all of those. But the flu and coronavirus have a fever. I take my temperature every day. I haven't had a fever. I've had kind of a low grade fever, but I haven't had a fever. Fatigue, body aches, and worsening symptoms, which means that to a certain extent, your flu doesn't react like it normally does. Like it doesn't go away after you've stayed at home and taken some medicine. Basically, it's not responding to your normal treatment. That's a big flag. And the coronavirus, again, the most important symptoms are shortness of breath. If you've been traveling out of the country, you need to take that into consideration in terms of your risk. If you find out that someone or work with has it, and you're like, well, okay, that's a known exposure, and then you can then sort of assess in terms of the severity of your symptoms. Again, these are some emergency warning signs. This is just for the adults. So later on, I'll do something to talk about what's going on with kids. Again, this difficulty breathing, if you have persistent pain or pressure in your chest, if there's confusion, if you or your loved one wakes up and you've got more than a fuzzy brain, or you're just unable to wake up and somebody's like, it took me forever to wake you up. These are kind of signs that sort of maybe the symptoms are really serious. And obviously bluish lips or face. But the real thing is difficulty to breathe. If you feel like you're gasping for breath, that's when you need to get medical attention immediately, okay? How is it spread? It's spread person to person. Basically between people with whom you've had close contact. Snuggling up with my kids, so I'm sure I got a cold from one of those guys. And again, it's spread through these respiratory droplets that, float around in the air after people cough and sneeze when they're not covering their mouth. Although right now we're not covering our mouth with our hand, do the chicken wing. And literally, it sounds really gross, but these droplets will float into your mouth, and that's how it gets in there. Again, this incubation period, so you can be hanging out with people and think that they're good to go and they're not sick, but you can get it from them, okay? And if you do know of someone who is sick, that is actually when we really need to stay away from people, because that's when they're most contagious, okay? Who's at risk? Honestly, the people most at risk are our incredible, valiant health workers who are at the front line fighting this pandemic right now. I want to give major props to all of my colleagues at SUNY Downstate Medical Center and Kings County Hospital. They are highest at risk because of exposure. They are getting far more exposure than the rest of us. And because of that, our healthcare workers are most at risk. There are, however, other vulnerable populations. And so those include if you are 65 years of age and older, and this has to do with just the biology of aging. When we get over 65, our immune system just starts to slow down a little bit. And there's something about this virus that really focuses in on the immune system. I don't know, I'm not a scientist like that, but folks who have chronic medical condition, heart disease, lung disease, if they're I spelled that wrong, immunocompromised, if they have HIV or have had cancer or have cancer now. Lots of stuff is showing up in terms of having diabetes or hypertension. And also people who smoke and vape. You remember a couple months ago, there was a whole vaping kind of crisis and all these respiratory ailments with people who are vaping. It's not really, smoking's not really smart in general. I know it's very tricky to stop smoking, but vaping is really not smart right now. I mean, if you're a smoker, go back to smoking cigarettes. Vaping is just not smart right now. I want to say that, you know, when we first learned about some of the risk groups, that we heard about lung disease, and I was thinking, you know, like this, by the way, that's my cat. I was thinking like lung disease is like serious lung disease. And then I looked at the list of lung diseases and I realized I have a lung disease. I've had asthma my entire life. I never ever thought of it as being a lung disease, I guess because my mom didn't want me to freak out. And so I thought it was just kind of, you know, a little, you know, minor issue. But actually people like me with asthma, who've had serious or moderate asthma their entire lives, we are really at risk. And we know our body and know our respiratory systems really well. And so we need to be very mindful. So some of those lung diseases include COPD, asthma, bronchitis. If you know you have a lung disease, you know, okay? So here's a list of some everyday precautions, how we can prevent the spread. Wash your hands. Okay, so I know you heard this. It's really true. The best way to do this is with soap and water. You do it for 20 minutes, and it's really important to do this like kind of rubbing action, like between your fingers. The thing is, you got to do it all the time. Like, it's going to be just annoying. We're going to have like the most amazing hygiene habits at the end of this, okay? But you need to wash your hands all the time, especially if you go in and out of your apartment, okay? That's like whenever you go in and out of something, you got to wash your hands, okay? You also want to get in the habit of just washing your hands before you eat anything. Okay, it's really, really important. You also really want to wash your hands after you've been blowing your nose, sneezing, or coughing. And you want to put all those tissues into the trash can and have the people around you put their own tissues into the trash can. Like us mothers, like it's not fair that we're picking up all these little tissues. Like, get your kids. I'm getting my boys to do that. You know, if you don't have access to water and soap, which is really the best, we are suggesting using hand sanitizers with at least 60% alcohol. And you know, you want to cover the entire surface of your hand and really let them dry. Cover your cough. You've seen this message. And you know, it's cover your cough with a tissue, cover it with a chicken wing, with your upper sleeve or the crux of your little elbow here. But this is how we reduce the spread of the disease, of the virus. You also want to avoid touching your face, your nose, your eyes, your mouth. I mean, a lot of us like constantly we're unaware. So we just need to practice this. And you need to try to figure out other forms of, you know, shaking hands or having contact. You know, trying to teach people about the elbow bump. Sometimes it's really hard when you have kids. Like my son just constantly wants to suck up on my face. But we will gradually make these changes in terms of trying to not touch each other so much. We need to just basically do some cleaning, and do it regularly. Makes me realize how much I've not been cleaning my house. Okay, so we need to, in particular, focus on those surfaces in our house that like we touch all the time, like tables, doorknobs, light switches, handles, desks, the toilet, faucets, sinks, and absolutely our cell phones, because this is like, there've been all kinds of studies in terms of just all the crazy, disgusting crap that is on our phones at the end of the day, and it'll gross you out. But like, we need to like be cleaning this off. Okay. And we need to do this regularly. Like, we need to get into a habit and a routine in the morning. After breakfast, I get like one of my sons to go around and to clean up all the doorknobs, and and I'm trying to get folks in my house to do the same. If you have to go out into public, when you go out into public, you see someone who's kind of sick, you stay away. 6 feet is the recommended distance. You see a crowd, don't walk into the crowd, avoid the crowd. I think it's not even permissible right now to do like most of these things that were recommended in terms of cruises. So I apologize for putting that on there. But I know that there's some young folks that are going to see like an ad saying like really cheap cruise. Like, stop that. Like, don't do that. It's really, really not a smart time to be doing that. I know that these companies want to try to save some money and try to book people, but don't do it. So, avoid any traveling, like stay home. I mean, most of our business stuff has been canceled anyway, but if someone sort of says like, do a road trip, come on up and visit me, I'm really bored, like, it's not really smart now. And with community spread, like, honestly, we need to be hunkering down in our house, and thinking about reducing the risk as much as possible. So guys, please, like, no house parties, okay? Think about like minimizing the number of people you have social contact with. Sometimes you live in a building, maybe it's like people, like maybe it's an immediate neighbor you'll include in your safe little space. You need to determine who those individuals are and how many you're going to let in. So, we've all been talking about social distancing, and, it's going to change the way that we interact. But, get in the habit of hollering out to people, across the street, or, moving to the side. But, like, don't do it in such an unfriendly way. We live in New York, but we can still be like, yo, and still connect with each other without being the fear of, oh my gosh. So practice social distancing, 6 feet, and limit your contact with folks. There's also some stuff talking about, like, if you're sick, to limit your contact with your animal. She won't leave me alone. It is what it is. If you're going out, avoid touching what they call high surface surfaces in public spaces. MTA is doing an amazing job of cleaning down stuff. But maybe you're going into places that don't necessarily have that. Like at Downstate, they're really on it in terms of cleaning the elevator buttons, door handles, handrails, handshaking should not be on this list. But, sometimes we can't avoid it. Sometimes we might need to hold on to that railing. So if you have to go out, be mindful of what you've touched. Don't touch your face, and don't touch anything else until you can get somewhere to wash your hands. Try to use a sleeve. Maybe you might carry an extra tissue so that you can hold on to stuff. Maybe you want to whip out your winter gloves, and you want to wash your hands absolutely after every time you've touched something out in the public. How to protect others if you're sick. If you're sick, stay at home, okay? Unless it's urgent. You want to stay at home and monitor your symptoms. It might be a regular illness, okay? It might be something that's normal, and I regret not putting a slide in here. Let me say that 80% of the people who are going to get coronavirus are going to get mild to moderate symptoms. These are symptoms that you can take care of at home. Okay. So I know that people are afraid and they're thinking, oh my goodness, I've got a sore throat, sniffles, and a cough, and I don't have a fever, and I'm breathing perfectly fine. Stay at home because our healthcare systems are being overwhelmed. We need you to stay at home, monitor your symptoms, okay? Because we can't test everybody at this particular point. And testing is really probably only for those most at risk and critical cases. So stay at home. Cover your mouth. If you're sick, cover your mouth and your nose. Sometimes maybe I regret that people bought all these masks because our health professionals really need it. But if you were one of those people that bought a lot of masks, like, number one, if the box hasn't been open, please donate it to a medical center or a clinic. But if you have one open, wear it on your face if you are sick. And if you are needing someone to take care of you and you're sick, give that mask to them to take care of you. So staying home is basically kind of, you're doing a self-isolation where you're caring for yourself at home. The CDC put out some recommendations in terms of sort of like when you're done with isolation. Number 3, in terms of getting a test and the text saying like you're negative, like, again, forget that. You can maybe assume that sort of you are better, obviously, if you feel better. But, if your fever has gone down and you no longer have symptoms, you can sort of safely assume that you have run the course of the virus and that you're okay. But then you need to check in with your doctor. And a lot of doctors and providers are doing sort of virtual ERs to be able to communicate with people. Quarantine is, well, it can be a state-enforced isolation, but, you can do a self-imposed quarantine. And we do this when, like, someone in the, groups of people are known to have the virus. You might quarantine a group. This is really important to prevent the spread of the disease to other people in the area. People are separating, they're staying together. And, the incubation period or the quarantine period is exactly the incubation period. So it's about 14 days, okay? A lot of talk about sheltering in place. I don't think our governor is going to do this, but basically that just means like, if there was an evacuation, I don't think that's going to happen. I just want to let you know, like, sheltering in place is a very extreme thing. It means like basically people are kind of like in their homes and that they really are not supposed to be going out. So this is really important. You need to have a plan before you get sick. So before you get sick, if you are, for example, in any of those risk groups, you want to call your doctor and leave a message for your doctor, to try to get information from them in terms of what you need to do based on your particular health issues or not. And, their advice in terms of how to monitor your health, okay, or monitor your symptoms if you should get sick. You want to stay in touch with people, social media, phone calls, whatever you need to do, screaming over the fence at your neighbor, your older neighbor, to just make sure that they're okay. You also might want to figure out like who's going to be taking care of you if you get sick, or who you can call on to maybe run an errand for you and leave stuff at your front door. So set that up in advance. And we need to be really mindful about our caregivers, and to make sure that they're also taking care of themselves. So in preparation, having a conversation with your doctor, you might need to request extra medicines in advance, especially necessary medicines. There might be some medicines that are not super important, but there might be medicines that are really essential. And you might want to see if you can get a larger prescription, like maybe for 2 or 3 months. And maybe also see if your pharmacy delivers. You want to make sure you have in your house, like, just over-the-counter medicines, like whatever you have used in the past to treat your flu symptoms. You want to have those around. Have, you know, for me, I need to have lemon and honey and some ginger and teas and stuff like that. You also want to make sure that you have really important household items. It's so funny about this whole toilet tissue thing. I guess the fear of dealing with your poopy. I've recently had kids, so I know that's not terribly adult language, but it's funny that this would freak people out. But trust me, there's going to be toilet tissue available. But you know, make sure that you have like food and essential sort of stuff that you to help you get through, and maybe not do it all at once. Maybe do it incrementally. So what do you do if you get sick? Again, stay home. Call your doctor. Tell them what your symptoms are. Avoid public places. Avoid public transportation. Some doctors have a virtual triage, which will be very, very cool. If you need medical assistance, and this, you should get this information from your doctor in terms of where you should go depending on where you live. Your physician might know where there is a testing or a place to provide care. I know that some neighborhoods might have an urgent care, and I don't know if they are scaling up to be able to deal with this, but I kind of feel like urgent care is not really equipped to be able to handle this. And so urgent care should just be doing with, like, you know, broken bones and stuff like that, and anything that's flu or potentially coronavirus related. Should not go there. Like, when we talk about medical attention, we're talking about going to an emergency room. So you need to call ahead and figure it out, because different emergency rooms that are preparing for this might have different staging areas depending on if you have one of those underlying risk factors from before, in terms of having lung disease or being immune compromised, etc. When you call 911, if you have to get emergency people to come and get you, you want to make sure that you let them know what's going on so that they can protect themselves. You want to wear a mask and cover yourself up as much as possible to protect others as well as yourself. And this is, oh, sorry, my thing is kind of covering, this says the New York City coronavirus hotline. And this is a number that we can call to get information and find out what's going on, and I would imagine treatment resources. So this is a lot of information. I want you guys to be safe and to take care of yourself. And we're going to figure out how to get through this. Wow, what did I just do? And we're going to get through this. We are going to get through this, guys. Again, I will be posting more videos with more suggestions on how to take care of yourself during this pandemic. Other suggestions, you know, to help with respiratory infections, etc., like just home remedies and stuff like that we can do. So I'm signing off. I will be in touch. Okay. Bye-bye, everyone. Remember, Star for Brooklyn. Be healthy for you. Bye.